Hi everyone, my name is Atika binti Mohit as the first presenter. Next, Sofia Amina will be second presenter. Meanwhile, for third and fourth presenter will be Izzat Izzuddin and Faris Farouk. Today, my group will be presenting Infographic Chapter 80, which is Symptoms, Sign and Abnormal Clinical and Laboratory Finding Not As Well Classified from R00 to R99. This chapter includes symptoms, sign, abnormal result, or clinical and laboratory finding that point rather definitely to a given diagnosis have been assigned to a category in other chapter of classification with no diagnosis classified as well is recorded. What is the difference between sign and symptom? Signs are objective. They are visible and can be quantified and verified. Signs are indicative condition factor which doctor can see. For example, fever. Meanwhile, for symptoms are subjective. They cannot be physically visible and cannot be verified. Symptoms are the condition and characteristic which person feel. For example, loss of taste and smell. According to medical coding guideline, A. Use of symptom codes. Codes that describe symptom and sign are acceptable for reporting purpose when a related diagnostic diagnosis has not been established or confirmed by the provider. Thank you, and I will pass to Sofia Amina for the second point.
Thank you, Atika. Now, I would like to explain on C, which is a combination code that includes symptom. As we know, ICD-10-CM consists of a number of combination code. What is combination code? Combination code is a single code used to specify two diagnoses or a diagnosis with a secondary process or known as manifestation, or a diagnosis associated with complication. In this chapter, combination code is used to identify a definitive diagnosis and also the common symptoms of that diagnosis. Hence, an additional code for the symptom should not be assigned. Then, we would like to proceed with D, which is repeated falls. When a patient has been accounted to the hospital due to a recent fallen and the reason for the fall is being investigated, code R29.6 should be assigned. If a patient has a history of falling in the past or he or she is at risk for the future falls, code Z91.81 should be assigned. Other than that, these both code R29.6 and Z91.81 will be assigned together if appropriate. Next, 4E is coma scale. When we talk about coma scale, it describes the consciousness level of the patient. A code for coma scale R40.2- can be used in conjunction with traumatic brain injury codes. However, the coma scale code should be sequenced after the diagnosis code. This is because the coma scale code will never be the principal diagnosis. Other than that, the seventh character should match for all the three codes. These three codes is very important and required to complete the coma scale. The first one is R40.21. It is coma scale eyes open. It is in order to ensure the eyes of the patient can respond or not. The second one is R40.22. It is R40.22, which is coma scale best verbal response. It is to determine either the patient can respond in verbally or not, and it is to record the level of speech of the patient. And the third one is R40.23, coma scale best motor response. It is where a physician asks a patient to make some movement either to show his tongue or close his eyes or to wriggle his toes. Last but not least, code R40.24, Glasgow coma scale total score will be assigned if only a total score is documented. Oh, and one more thing, do not report codes for an individual or total Glasgow coma scale score if a patient with a medically induced coma or a sedated patient.
Thank you, Sophie. SRS due to non-infectious process. The systemic inflammatory response syndrome, SIRS, can develop as a result of certain non-infectious disease processes such as trauma, malignant neoplasm, or pancreatitis. When SIRS is documented with a non-infectious condition and no subsequent infection is documented, the code for the underlying condition such as injury should be assigned followed by either code R65.10, SRS of non-infectious origin without acute organ dysfunction, or the code R65.11, SRS of non-infectious origin with acute organ dysfunction. If an associated acute organ dysfunction is documented, the appropriate code for the specific type of organ dysfunction should be assigned in addition to the code of R65.11. If an acute organ dysfunction is documented, but it cannot be determined whether it is associated with SRIS or other condition, for example, it is directly due to trauma, then the provider should be queried. And now for death otherwise specified, the code R99, ill-defined and unknown cause of mortality, should only be used in very limited circumstances when a patient who has already died is brought into an emergency department or other healthcare facility and is pronounced dead upon arrival. This does not represent the discharge disposition of death. And now, Ahmad Faris will explain the next part and conclude for this chapter. Thank you.
Thank you, Izzat Izzuddin. Assalamualaikum and hi. Next, I will be explaining on the last part of chapter 18, which is NIHSS stroke scale, and conclude this chapter as a whole. The codes R29.7-, which is National Institutes of Health Stroke Scale NIHSS, can be used in conjunction with the codes I63, which is acute stroke, to identify the patient's neurological status and the severity of the stroke. On top of that, the stroke scale codes should be sequenced after the acute stroke diagnosis codes. After all, hospital need to report the initial score documented, or a facility may choose to record multiple stroke scale scores if needed. To conclude this chapter as a whole, many people use the words sign and symptom interchangeably. However, there are important differences that affect their use in the field of medicine. In this chapter 18 of ICD-10-CM, it contains codes for symptoms and signs that affect the medical care and management of the patient. Besides that, abnormal findings and ill-defined conditions are also coded to this chapter. Anyhow, codes from this chapter should not be used if a more definitive diagnosis is available. The signs and symptoms are coded until a specific diagnosis is assigned. In addition, symptoms are not usually sequenced as a principal diagnosis when a related condition has been confirmed. While there are differences between signs and symptoms, they are both ultimately methods the body uses to communicate health problems and trigger the search for a solution. Hence, it is important not to ignore symptoms you discover by yourself or any signs found by a doctor. Thank you.